All right. The abnormality show if there is any risk of developing cervical cancer or not, on assessing if you are at particular higher risk than the general population, then you might need further tests to double check and be sure that what are the level of your own risk, and based on that we'll decide what's in further, if any further management is required and what it is. Usually the first abnormality on a long range of abnormalities ending in cervical cancer, they all start with human papillomavirus infection. The vast majority of human papillomavirus infection it resolves with just immunity, personal immunity, but very few number of them can progress into abnormal cells, and this cell abnormality varies from mild to severe. Still, the mild abnormalities disappear just by their own immune system, but the higher grade the abnormality is, there will be a bit more risk that this might develop into cervical cancer. The vast majority of cases with abnormal smear ended up showing no significant abnormality. The main aim, we're trying to reduce the risk of cervical cancer. The risk is very small, but we try to reduce that as much as possible in the general population. So with our cervical screening program, we managed in the United Kingdom to have a lot of drop in the number of cases diagnosed with cervical cancer. But for each special person, the personal risk of developing cervical cancer is very low. We try to make that even lower. So for every single case with abnormal smear, most of the cases we don't find an abnormality, and in the cases where we find an abnormal cells, usually there is an easy, quick way to get rid of that and very much reduce the risk of cervical cancer. An abnormal smear doesn't mean cervical cancer. We're mainly looking at the risk of developing cervical cancer in the future. In most of the cases, we don't find any high risk of that, but in the cases where we actually see cells showing that there is a risk of cervical cancer, detecting that at a very early stage by the cervical smear allow us to safely and quickly remove this cell abnormality, and that reduce the risk back to the normal population. An abnormal smear depends. If it is only human papillomavirus abnormality and no abnormal cells, usually we repeat the smear 1 year later. If the second smear again shows human papillomavirus, or if abnormal cells were seen on the first smear as well, then the next step is to review cases in the colposcopy clinic. In the colposcopy clinic, we look at the cervix with a magnifying equipment. We apply some special stains on the cervix to identify if there is abnormal cells or not. If the colposcopy shows no abnormality, then we can safely go back to a 3-yearly cervical smear. While if the colposcopy shows an abnormality, then depending on the degree of this abnormality, we'll decide whether we'll just keep an eye on it if it is low-grade abnormality, or we better treat it. And we treat the cases only with high-grade abnormality with the aim to reduce the risk of cervical cancer. The treatment is usually safe and relatively simple and quick. It takes about 10 to 15 minutes to be done in the colposcopy clinic, and it's much reduced the risk of cervical cancer in the future.